Hello, friends. My topic is dry eye care with contact lenses. I am Dr. Vishal Madan, representing Dr. D.Y. Patil Institute of Optometry and Visual Sciences, DPU, India. Well, everybody knows about dry eye and the condition it causes. Dry eye disease is most common condition which are managed by contact lens practitioners and with other some novel contact lens options which are offered as an alternative to the traditional methods and therapies of ocular lubricants. However, till today date, the options described here are little, if any, clinical data pertaining to support the use of management of dry eye disease with further clinical studies are still required. Use of contact lenses in the quantification of annulates in tear film has primarily focused on diagnosing and monitoring the ocular conditions. Tear film contains a wide range of biomarkers which help in diagnosing the systemic diseases for a range of conditions. A contact lens based diagnostic device would allow a biosensor to be placed in the ocular tissue and also introduce in the tear fluid, which reflects in a real time pathophysiological changes in several systemic and ocular diseases reflected in dry eye conditions, as we are mentioning here. Various techniques are tried to optimize uptake, the release of drugs to the ocular surface to treat dry eye in the case of dry eye conditions. The placement of contact lens on the ocular surface physiologically helps in diagnosing the contact lens related conditions, which has a potential to be giving us a ample of additional clinical information to aid in diagnosis and monitoring of dry eye disease and morbidities in stimulating lacrimal gland for the secretion of tear fluid. Tear film and its properties, osmolarity is an important tool in diagnosis and management of dry eye disease. Researchers have developed a prototype contact lens which can evaluate the osmolarity, tear evaporation rate, and ocular surface temperatures, which all together aid in diagnosing dry eye disease. Inflammation cytokines and other biomarkers, as I have mentioned in my previous work, is in dry eye conditions range from chemokines in elevated found in the tears of the dry eye patients. There are also markers which are there which can directly relate in finding out the conditions which can definitely cause the condition of dry eye to be worsened. And placement of contact lenses would allow in real time to monitor such changes in the tear film which can be monitored and also accordingly dealt with. This is an event cycle where you can see that there is a very gross circulation of inflammatory markers which result in dry eye, and inflammation and dry eye conditions in the eye are directly responsible, are cyclic in nature. As far as the contact lenses are concerned, there are further enhancements which can be used. Not only does it measure and monitor and aid in diagnosing the inflammatory markers, but also it can be used to measure the blink monitoring of a person if the blinking isn't the culprit. So the lenses like triggerfish, which can be modified for monitoring as well as aiding in correction of the blink rate for people who have reduced blink rate, as it is very commonly seen in people who are in front of visual aids, monitors, and other visual devices. There is also possibility of having structurally colored contact lens sensors. Well, these sensors are responsible for changing the color, and accordingly, these sensors will detect the change in moisture and pressure by altering the color of the lens. This is under development and it can be further improvised to be used to detect accurately the change in osmolarity of tear film. Well, the journal guidelines for selection of lenses that in case of acute conditions, there should be a plan management of having clinical signs and symptoms, and furthermore improvisation of using contact lenses with silicon hydrogel lenses, and should be used for a short duration of time. Chronic conditions where there is a chronic pain, there is scarring, and there is a healing difficulty of the cornea as well as the surrounding tissues. There should be further use of enhanced silicon hydrogel materials and similar materials. Also, the use of scleral lenses is promulgated for this sort of conditions. For post surgical conditions management, there is also a condition where there is a epithelial erosion syndrome, which is probably more pronounced after the surgery. So use of silicone hydrogels as well as use of short term enhanced lubricants and wear is advised. Dehydration resistant materials are in fancy now, and there is a good development of good materials which can be used to prevent further desiccation of the ocular surface due to pervaporation and absorption of fluids from the lens, from the cornea into the lens. These materials are definitely helpful in giving people dry eye management and also enhancing and making it more friendly for dry eye conditions. So, this is the future for it. Lacrimal gland stimulation is another technique which can be used to improvise the condition of a dry eye person. So, in cases of physiological dry eye or related to a condition where there is insufficient production of tear flame by lacrimal gland, this kind of technology, which can stimulate the lacrimal gland by producing electrical impulses, can definitely help in stimulating the lacrimal gland over a period of time so that sufficient amount of natural tears is produced in the eye to alleviate the condition of dry eye. Recent patent highlighted by many companies have shown that it is a promising kind of technology which can be used to alleviate the dry eye by stimulating this. Scavenging of reactive oxygens is also another way, as we are aware that there is a lot of oxidative stress which has been produced by putting contact lens, as there is a friction as well as there is a reduced circulation of tear flowing in front of the lens and after the lens, that is called pre-ocular tear film and post contact lens tear film. So these conditions can be also sorted out by using certain materials which can easily and importantly do scavenging to reduce the reactive oxygen, which can cause different inflammatory conditions which can further result in dry eye and aggravate the condition. These lenses are also being designed in such a way that it can easily scavenge the reactive oxygen and also maintain the good transparency and biocompatibility in ocular surfaces in animal models specifically. We can do this in our human trials. Pupil and iris defects can be also sorted out, and this kind of conditions can be very commonly used for people with special ocular needs where they need cosmesis as well as condition where they need to prevent any other clinical conditions which can be aggravated by these pupil and iris defects. And there are a lot of contact lenses which are being already used as prosthetic lenses, but furthermore, these can be helped to used and also help in dry eye management. Hydropropyl, hydroxypropyl cellulose dissolvable inserts are known previously, and they have been used more probably now with the addition of carboxymethyl cellulose, which is a better naturally occurring lubricant, which can be also used in cases of moderate to severe dry eye patients and can be used as a conventional treatment with artificial tears if they are found to be inadequate. Each insert will have 5 milligrams of hydroxypropyl methyl cellulose, and which slowly is released in the tear flame, which helps in placing the cornea to a lubricated and a healthy situation or a circumstance. The inserts are able to wear patients' symptoms and measured by ocular surface disease index, or we call it OSDI, as well as the signs of dry eye can be noted and recorded and can be measured. Cyclosporin therapy or T cells inhibitors are also very commonly used to decrease the immune response to a dry eye condition, which, as I have in the previous slides, it has been shown that it is a cycle which has to repeat if the dry eye increases from minimum to moderate and goes on to become severe. So in to target that condition where we can control the inflammatory markers, we need to introduce immunosuppressants in the form of cyclosporin, and this is shown to be very useful. Etaphelicon A lenses maintain they have been found to maintain and release for dry eye conditions, and it has been shown successfully in vitro conditions. Commercially available silicon hydrogel lenses, which are comparable more as compared to hydrophobic ones, are shown to be having promising results and release drug without any further modifications for up to 2 weeks. Release from silicon hydrogel materials can be further enhanced through deposition of coating of vitamin E, which is treated with xenophilicon A based on silicon hydrogel materials or lenses have shown to release cyclosporin for more than 1 month in vitro conditions. So these are very promising results wherein a contact lens is used to alleviate the dry eye conditions. Scleral lenses are the ones which are very much in trend, and they are shown to have very promising results as far as the moderate to severe dry eye conditions are concerned. Scleral lenses are highly safe and have ample of benefits of having good optical as well as physiological properties, and they have shown to help and to alleviate the conditions of dry eye where other therapies and management procedures fail. Scleral lenses are here, and they are here with different types of modalities, and they are matching for all type of age groups, whether it is children, whether it is adults, and whether it is teenagers. They are very much acceptable and easily usable. In recent years, FDA has shown that this can be used in solving the severe dry eye condition which are seen in keratoconjunctivitis sicca, KCS, or Sjorgen syndrome, where in that cases it has become imperative management therapy for dry eye with the use of scleral lenses. Because of these new standards, scleral lenses are now more commonly used as specialty contact lens than in other conditions, and it is one of the favorites for dry eye management. Scleral lenses for dry eye lenses, as I said, dry eye disease, sorry, as I have mentioned, is the treatment to be used when the conservative treatments have failed or they have not shown promising results. The conservative treatment would start, as everybody knows, and I will repeat for your revision: artificial tears, lid therapy, topical medications, and punctal plugs. So when these things do not go to a limit of working, then scleral lenses become imperative. Thank you.